How to distinguish PTSD dissociation from other mental health issues. Understanding how to distinguish dissociation related to post-traumatic stress disorder from other mental health issues can be challenging. It is essential to recognize the unique features of PTSD and how they manifest in dissociative symptoms. PTSD can include a dissociative subtype characterized by specific symptoms like depersonalization and derealization. These symptoms are often triggered by trauma exposure, which sets them apart from dissociation seen in other mental health conditions. To diagnose PTSD, there must be evidence of exposure to actual or threatened death, serious injury, or sexual violence. This exposure can occur directly, by witnessing it, or even by learning about it happening to someone close. Dissociative symptoms in PTSD arise in response to these trauma-related stressors, making this connection crucial for differentiation. The dissociative subtype of PTSD is marked by persistent or recurrent episodes of depersonalization and derealization. Depersonalization involves feeling detached from oneself, almost as if observing one's actions from outside the body. Derealization, on the other hand, is the experience of the external world feeling unreal or distorted. These symptoms coexist with classic PTSD symptoms such as intrusive memories, flashbacks, avoidance behaviors, negative mood, and hyperarousal. Dissociative reactions in PTSD often manifest as flashbacks, where individuals feel as if they are reliving the traumatic event. This can range from brief moments of altered awareness to a complete loss of awareness of their current surroundings. Such trauma-specific flashbacks are less common in other mental health disorders, like generalized anxiety disorder or depression. While PTSD with dissociation shares some symptoms with primary dissociative disorders, such as dissociative identity disorder, the key difference lies in the presence of trauma-related PTSD symptoms. Primary dissociative disorders may not exhibit the same trauma-specific intrusive symptoms or hyperarousal features that are characteristic of PTSD. Diagnosing PTSD with dissociative symptoms involves a thorough psychiatric evaluation based on the Diagnostic and Statistical Manual of Mental Disorders criteria. This includes meeting all PTSD symptom criteria, having dissociative symptoms in response to trauma, and ruling out other medical or psychiatric causes for the dissociation. When trying to differentiate PTSD dissociation from other mental health issues, consider the context of symptoms. If dissociation is closely tied to trauma cues, it suggests PTSD. The type of symptoms is also telling. Flashbacks and trauma-specific intrusive memories are hallmark features of PTSD. Additionally, the duration and persistence of these symptoms in relation to trauma reminders are important. PTSD often coexists with anxiety and mood symptoms, which may not be as prominent in other disorders. In summary, distinguishing PTSD dissociation from other mental health issues relies on recognizing trauma exposure, the specific nature of dissociative symptoms, and the characteristic PTSD symptom cluster. A careful clinical assessment is essential for accurately identifying PTSD with dissociative symptoms and differentiating it from other conditions that may share overlapping features. Always consult a healthcare professional for personalized advice and support.